Hello, my name is Otniel Delgado.
I'm Alex Konvalina,
And I'm Shira Rindsberg.
and our presentation is on the differences between the MD and DO degree. So first, why is this important? Well, all four of us are biomedical science majors who are on the pre-professional track and who eventually want to end up in some sort of med school. It's important for us to know the difference between all the medical degrees, even if they aren't that different after all. Because as we found out, the MD degree and the DO degree are actually very similar. We will discuss the differences in the application process, the curriculum, and philosophy. These are all important for us to know as we prepare to apply and decide which degree we will pursue. So MD degrees, which is the medical doctor degrees, concentrate on allopathic medicine, while DO degrees gravitate more towards osteopathic medicine. Allopathic medicine focuses on diagnosing and treating human diseases, and osteopathic medicine is more focused on reaching a diagnosis and finding the root cause rather than just treating it. Also, DO doctors are more open to other techniques such as holistic approaches, while MD doctors tend to go straight to medicine. Students generally choose to pursue an MD degree. According to the American Osteopathic Association, in the United States, there are 114,000 practicing DOs versus 800,000 practicing MDs. As it becomes more popular to be a DO, they are projected to represent more than 20% of all practicing physicians by 2030. This is reflected by the fact that there are 57 DO programs, including branch campuses in the US, compared to 154 MD programs.
So, as we said earlier, there are a lot of similarities between the degrees, and I will start off by talking about these similarities. For both of the degrees, the first 2 years of medical school are basic sciences. So this is more in depth into some of the same sciences that we learned in undergraduate. The following 2 years are clinical rotations, where students will work with different physicians in 6 to 8 week rotations to experience all the different specialties. This will help us decide what we want to specialize in, which in turn will decide what we complete our residencies in and what we will eventually be practicing. Both DO and MD degree holders can specialize in whatever career they want, including all surgical specialties. There are no limitations based on what degree you ended up getting. Also, as of 2019, both MD and DO degree holders will be competing for the same residency opportunities. They are merged, and every student will apply to the same programs. This is good news for the DOs who previously had fewer options for residencies, as there were specific residencies that were earmarked for the DO students to be able to apply to. So now I will talk about some of the differences and also similarities in the application process. Now, for MD degrees, the MCAT is required and you must have your bachelor's degree before applying to an MD program. Also, any major is acceptable, but they do have required courses like Biology 1, Chemistry 1, Organic Chemistry 1, and all of those types of courses. They require 5 letters of recommendation, and it is strongly suggested that you have 3 from your professors, including 1 non-science professor, 1 from a researcher, and 1 from a practitioner who is preferably an MD practicing maybe in like a field you're interested in, who you have shadowed. Also, an MCAT score of 510 is competitive. They use the application service of AMCAS. For DO degree seekers, they do not actually require the MCAT. Certain programs like LECOM will look at the SAT or ACT score and use that to factor in for the application decision. Also, they do not require a bachelor's degree. Some programs only suggest 90 undergraduate credit hours, which totals about 3 years of schooling. They require 3 letters of recommendation, but of course, the more the better, so it's better to have 4 or 5. It is also strongly suggested that you shadow a DO and receive a letter from them to show your interest in the field. An MCAT score of 505 is competitive, and as you can see, this is slightly lower than the competitive MCAT score for MD degree seekers. They use the application service of ACOMAS.
Okay, then I'll be looking at the differences between the two curriculums. For DOs, principles and practices are integrated into their 4-year curriculum. DO programs learn about OMT, which is osteopathic manipulative treatments. OMT courses are taken every single year. One unique characteristic for DO programs is that their clinical rotations are carried out in hospitals across the country, unlike MD programs, which have a paired teaching hospital. According to scripts, DOs receive extra instruction in the musculoskeletal system, the body's interconnected system of nerves, muscles, and bone, and have a larger focus on anatomy when compared to MD degrees. This is due to the important skills of OMT that DO physicians have an integral focus on. DO students take the COMLEX board certification exam, which contains information about OMT, while MD students take the USMLEs, which do not include OMT. Now in this photo, this is a basic overview of the curriculum for OSTO Med School. The graphic contains a list of all the different courses that will be taken over the 4 years of DO school. While they're very similar to the MD curriculum, the differences come into play with the OMT courses, which are taken every year of DO school.
Hi, my name is Campbell Welch, and I'm going to be talking about some of the differences in philosophy between the two degrees and some stereotypes you should be aware of. So DO doctors, they think that when one part of the body isn't doing well, it's going to affect the whole body. So they try to look at the root of the problem and see how that happened, how it's affecting the whole body, or how it's affecting that individual body part that's diseased or injured. They also care about the overall health of their patients, and they have a more holistic approach to medicine. DO doctors, they're also more open to trying different approaches as opposed to MD doctors who immediately prescribe medicine or go into surgery. They try to look at what caused the problem and see if they can fix it before prescribing medicine or going straight into a surgery. So for stereotypes, DO degrees, there's a negative stereotype around them. One of the first stereotypes is that most people go to DO school because they don't think they're competitive enough to get into MD school. So they don't think they have high enough test scores, enough volunteer hours, or strong recommendation letters. But it's actually not the case, and DO doctors are actually attracted to the DO philosophy, and they choose to pursue a degree in osteopathic medicine because of that. The truth is that DO doctors are actually just as credible as MD doctors. They have the same curriculum, they learn the same things, but they actually have an additional tool. It's called OMT, which is the osteopathic manipulative treatment, and they should be treated with the same respect as MD doctors because of that. So the good thing is that the stigma against DO doctors is slowly receding, and which is good because they're just as credible despite their lower requirements to get into that school. So these are our citations, our sources that we found our information for, and I hope you learned something about the two degrees.